My name is Christine Kennedy. I'm from Overland Park, Kansas. I'm 38. I'll be 39 this summer. I have a 1-year-old daughter. I first had breast implants when I was about 20 years old. Saline implants, July of 1992. I think that's when it was. And they were above the muscle, and they were fine. They lasted about 17 years, which is a really long time, I guess, for breast implants. But then after I had my daughter, I had gone to see a surgeon to have some skin cancer. There could have been something wrong with my left implant, and that while I was there and with the anesthesia and with the cost of everything, that I should consider having them replaced, because saline implants, I guess, you're not supposed to have that long. So I was like, okay, you know, with having, at that point my baby was 3 months old, so he really pitched the fact that one recovery time would be the most optimal thing. So we didn't really do a lot of research with this doctor. It was a referral from a family member, so we just kind of went for it. Within probably 10 days, I was having the surgery performed. So when I woke up, I had a lot of complications, and long story short, it ended up, I needed to wait 6 months to see how I was going to heal, to see what I was left with. And then that was in February. And so now it's May, and it took about 9 months, but there's a really an issue with the symmetry, and one being definitely under the muscle, one, the mammogram showed that it wasn't at all, and if there's any sign of it being under the muscle, it would be like, I guess, a really shallow pocket. So we started looking, my husband and I started looking on the internet, because in the Midwest there aren't a lot of options for revision surgery. I had talked to another surgeon there, and he wasn't confident that he could really improve the look of the implants. He suggested a breast lift and some other things that seemed extreme to us. And so we started Googling on the internet and found Pousti. Dr. P email, and right away they emailed back, and then really within, I would say probably 2 days, Dr. P called himself and discussed the situation with me, and really made me feel at ease, and said if we wanted to continue to go forward, to send him some photos of my current situation and anything I could remember about the surgery. Not really surgical notes, I can't exactly remember what he had asked, but he had me send him some pictures, so I sent the pictures, and then he called back again. So he spent a lot of his personal time before he even knew if we would fly from the Midwest. So he really made us feel comfortable that he was attached to the outcome, and he was confident that he can improve my results. So we scheduled a surgery date, and we just flew out, and we just really felt confident in the phone interaction and the email interaction. The office staff was helpful. They called every other day. It's probably every other day they called to give us updates on what was going on, surgery time, just to make us feel at ease that they were a very organized, efficient office and on top of it. So we felt great about our decision. Came out 2 days before the surgery, and so today is the pre-surgery date, and then my surgery is in the morning, so that's exciting. And it was nice that Dr. P actually marked everything up and took measurements, and the last surgeon in August didn't do any of that. There was no measurement, there was no diagnostic to it. It just kind of seemed haphazard how he approached the surgical angle of that, as opposed to this doctor. As well, the doctor that had done the surgery the 17 years before, he actually took the measurements and marked, and so it was kind of interesting that the surgeon in the middle that seemed to cause the conflict hadn't marked anything up. So he did spent a lot of time with us doing the measurements, explaining the implants, not just saying, okay, you're going to go with this many cc's and that's just that. I mean, he actually explained the chest cavity and how the implant covers the space, and are you looking for the cleavage, are you looking for the upper fullness. It was a full consultation on what it was that we were looking to achieve, not just bigger breast. So it was more of an artistic approach to the surgery, as opposed to just a chop shop where it's like you just feel like you're the next person on the table, and just next for the cosmetic surgery. So it's been wonderful, and we're looking forward to the surgery tomorrow. And recovery time was little to nothing, really. Tuesday after surgery, I don't remember a lot. I was really groggy, and then Wednesday I was up, able to eat, and then Thursday my husband and I actually went shopping downtown. So we got out of the hotel and shopped for a few hours and came back, and then today we've been enjoying the beach and La Jolla. And so really the anxiety was for nothing because everything just it went really well. The recovery time has just been phenomenal. It's been amazing. I don't feel like I just had surgery 3 days ago. I would recommend Dr. P, hands down, bar none. His website was so informative and truthful, because that was my other apprehension coming from the Midwest out to the West Coast. You don't know if what you're seeing on the internet is true. So that, we had to step out on faith, and we're praying people, and we stepped out on faith and thought we're going to be in good hands. Start to finish, I can 200% say that I would recommend Dr. Pousti. That was the other amazing thing about the office, that you get phone calls from the staff from numerous different people, and everyone is so genuine. So it's just a genuine care about how the patient's doing, which is refreshing.
Yes,
Thank you.